Hey all, welcome to my channel. It's Dr. Priscilla here. Today we're going to be talking about ACE inhibitors and easy ways to remember that. So ACE inhibitors are predominantly medications that end in prils. So a chief example of that is lisinopril. We all know that. That's like one of the predominant example of the medication that we use there. And what is this medication used for? This medication is used for hypertension. Hypertension and heart failure. And what else are we using this medication for? Kidney protection. Someone that has low kidney function, we're wanting to increase the use of their kidneys, and we're wanting to protect that kidney so they can last longer and do everything it's supposed to do. So that's part of the reason why we use them for that. So how do ACE inhibitors work? So they lower your blood pressure, and they relax the blood vessels. So they relax the blood vessel, causing the blood pressure to decrease, and then decreasing the workload of the heart, improving circulation. So everything is relaxing. Just some ACE inhibitors makes the muscle relax, the smooth muscles within your blood vessels. And that helps in turn improve circulation. So that increases the ability for your body to decrease in blood pressure. So NCLEX tips and things to remember. So pril protects pressure. Pril pills protect pressure. If you guys like it, great. If you don't, then just don't think about it. And then another one that I like is blood pressure lower ipril is another mnemonic too. So most common side effects is you have a dry cough and hypertension, dizziness. If you're decreasing someone's blood pressure, you're going to have that orthostatic hypertension. If you get up too fast, then you're going to feel lightheaded, hyperkalemia, just because you're having that increase in fluids as well. And then angioedema. So if you're relaxing the vessels, you're going to have some relaxing of the fluids into the legs. So that helps, that causes that edema. So critical things that you want to think about NCLEX warning for angioedema. So you were going to have that swelling, lips, mouth, or lips, tongue, and throat. And we're thinking about not being able to have the airway, ABCs. Remember, ABC, air breathing circulation. That could be potentially life-threatening. And so stop the medication immediately, contact the provider or ER immediately. So that's what we're thinking when you're thinking about angioedema, swelling of the face, lips, mouth, throat. Stop the medication, contact provider, ED, stop the medication. So nursing consideration, monitor the blood pressure always, monitoring potassium levels, and also the kidney function as well. So when you're monitoring for kidney functions, seeing if this medication is actually helping to improve that kidney function. So that's for dizziness, and this is increasing falls because you have an increased risk for orthostatic hypertension, feeling lightheaded, dizziness, increases falls. So let's decrease the fall risk. So key labs, we're going to do the creatinine, BUN, and potassium, just the kidney functions as well, to make sure we are within the appropriate ranges for that, because we are messing with the blood vessels. We're relaxing those blood vessels, as we discussed earlier. hold. And also we want to educate the patient. Yes, the provider educates the patient, but also, as RNs, nurses, we also want to educate the patient. Rising slowly. You don't want to get up too fast, because if you get up too fast, even if you're not on blood pressure medications, or the ACE inhibitors, if you get up way too fast, you're going to feel a little dizzy, a little lightheaded. Report swelling immediately. So if you have swelling in your feet, hands, lips, have them report that, even if it's minuscule. And then avoid potassium supplements unless you're being prescribed a potassium supplement. Monitor blood pressure at home and report low blood pressure as well. So I would have patients take daily blood pressures, or even if they're feeling lightheaded, have sit down, put your feet up, and take your blood pressure. That's what I educate patients on. So NCLEX questions. So question: patient develops tongue swelling, ding ding ding, after lisinopril. What should the nurse do? Stop the medication, notify provider immediately, is your answer. So key NCLEX takeaway: ACE inhibitors and in Pril. The classic side effect is the dry cough. That's very high on test, NCLEX school test as well. Watch for angioedema, swelling the face, and then monitor for potassium and kidney functions as well. I hope this helps you guys. All have a great day. Bye-bye.